Let's understand about the CSF pictures of bacterial, viral and TB meningitis. In bacterial meningitis, CSF gross appearance will be turbid. Whereas in viral meningitis, the CSF is clear. In TB meningitis, if you take the CSF specimen in a test tube, the bottom part of test tube will contain some fibrin web-like structure that is called fibrin web or web coagulum. This is the very important gross feature finding of TB meningitis. This is very important MCQ previously asked. Sugar. Pyogenic organisms or bacteria love sugar, so they tend to eat the sugar in the CSF. So sugar will be very low in pyogenic meningitis. Viral, you can say normal to low. It's not very significantly low, but it will be borderline low. In TB also it can be low, but not very low as such in pyogenic meningitis. Here the important thing is pyogenic meningitis has very less amount of sugar. Next, protein. Protein content will be a bit high in bacterial meningitis. Even in viral meningitis, protein content will be high. In TB meningitis, protein content will be very high. Okay. Here the MCQ is protein content will be very high in TB meningitis. Cells. Polymorphonuclear predominance is seen in pyogenic meningitis. That means neutrophil predominance. In viral, lymphocytic predominance, also called mononuclear predominance, mononuclear cell predominance. Even in TB, there is lymphocytic predominance or mononuclear predominance. Okay, and the other specific feature in bacterial meningitis is gram stain become positive here in 70% of cases. In TB meningitis, AFB stain will be positive. Okay, this is the important CSF picture in meningitis. So the differentiating feature, definitely you will get a clue about maybe they will mention about turbid CSF, that means that points towards bacterial meningitis. Maybe they may point towards fibrin web or web coagulum, that means it is TB meningitis. If the protein content is high, they say you cannot differentiate between viral and TB. Then you need another clue like AFB stain they should give, or TB, any picture of TB bacilli or CB nat coming positive, or fibrin web coagulum's gross picture. They'll give something. If they give about lymphocytic predominance and protein high, you cannot as such differentiate with these two clues. They'll definitely give some other clue. But bacterial meningitis, it is very clear. It will be very clearly given in the question that sugar is very low, or it is turbid, or it is gram positive, or neutrophil predominance. It's a bit unique when compared to viral and TB meningitis. So now let's look at normal CSF picture. How normal CSF looks like. Okay, normal CSF glucose or sugar content should be almost equal to 2/3 of blood sugar. Like if the blood sugar is 100 mg per dl at that point of time, we have to understand that CSF sugar should be around 66 mg per dl. This is normal. Less than this is slightly abnormal, you can say. More than this will be normal. Proteins are 15 to 45 mg per dl. Cell count is less than 5 cells. This is normal. Okay, let's solve some examples. We'll get to understand it in a better way. 25-year-old male patient presented with fever and seizures since 1 day. LP has been done and CSF is clear. Given CSF is clear is a clue. Even you can take that fever with seizures is also a clue, because Generally in bacterial meningitis seizures are a bit rare, but in viral encephalitis seizures will be common, because encephalon, brain, is involved in viral encephalitis. In bacterial, generally it will be meningitis. Generally seizures are not the initial presentation. LP has been done and CSF is clear is a clue. And then they have given the blood sugar as 100 mg per dl. CSF picture is showing sugar of 60 mg per dl. Like almost it is around 2/3 range. So you can call it as normal, very borderline low. So you can call it as normal sugar. Protein is also normal. Lymphocytic predominance. Okay. CB nat of CSF is negative. Okay. They have given this clue. That means it's not TB, because CB nat is negative. So depending upon the options, we will rule out first. TB meningitis is not the answer. GBS is not the answer, because GBS presentation is not this. GBS presentation is different. It is like paraplegia or any ascending weakness or facial palsy, any other variants. Okay, fever with headache or seizures is not the presentation of GBS. So viral meningitis and pyogenic meningitis. As we discussed pyogenic meningitis, the sugar should be less than 1/3 of blood sugar. Sugar will be very low here comparatively. It should be less than 1/3, like less than 33 mg per dl if 100 mg is the blood sugar. So this is not the answer. So we can rule it out as viral. Answer is viral meningitis. Okay. Second question. 12-year-old male, complaint of fever and headache since 3 days. LP has been done. Blood sugar is 90 they have given. So CSF sugar is 3 mg per dl. Oh my god, it's very low. It's like 5% of blood sugar. So it is very low. So very low sugar is characteristic of pyogenic meningitis. Moderately elevated proteins. There is one more classic clue. 90% neutrophil predominance and 500 cells. Normal cells are 5. Here there is pleocytosis which has neutrophil predominance. This is classic pyogenic meningitis. Next, third question. 25-year-old female presented with acute onset bilateral lower limb weakness which is ascending in nature. History of eating food outside 1 week back and had episode of gastroenteritis. Okay, this history is classic GBS, because this is AIDP presentation, demyelinating polyradiculoneuropathy. Here we will learn about the CSF picture of GBS. This is an autoimmune condition. In autoimmune condition like GBS, the classic CSF presentation is albuminocytological dissociation. It's nothing but albumin is protein. Protein content will be elevated, but cytological count is number of cells. Cells are normal. That means albuminocytological dissociation means cell count will be normal but protein count will be high. This is the very important MCQ. Okay.